Welcome and good evening to Ask the Docs about prenatal oral health, the importance of oral health during pregnancy. We are so excited to have you all here tonight. So again, welcome on behalf of the Children's Oral Health Coalition and the Department of State Health Services. We want to welcome you to our second Ask the Doc session. These are discussions about not delaying dental care during pregnancy and what dentists and OBGYNs can do together to make a bigger difference in the lives of pregnant women. I am Dr. Tanya Fuqua. I am the Director of Child Oral Health under the Center for Children's Health at Cook Children's. I am a general dentist. I practice part-time, and I am privileged enough to get to work with and alongside our two panelists this evening. We're going to start with a Q&A from our two panelist experts this evening. During the discussion, we'll pause and ask about 3 or so polling questions. After the Q&A, the panel will take questions from all of you all that are joining us this evening. Then we want to get your feedback on the session, so there'll be a little link for you to go on and click, because we want to learn. This is just our second time to bring healthcare providers, OBGYNs, dentists together to have a conversation. So we want to make sure that we are learning from this. We will have each of the speakers to provide key information relevant to why dental care should not be delayed during pregnancy and what we can do. So without further ado, I want to introduce our two panelists for this evening. Our first speaker is Dr. Rhonda Stokely. Dr. Stokely has served as the Public Health Dental Director and Manager of the Oral Health Improvement Program at the Texas Department of State Health Services since 2016. I'm going to use the acronym, the OHIP, that Oral Health Improvement Program, primarily focuses on maternal and child oral health through education, prevention, services, and surveillance. She previously served as the state dental director at the Austin State Supported Living Center. Dr. Stokely also has private practice experience, including practice ownership. She is a member of several dental organizations, including the American Dental Association. She lives in Austin with her husband and 2 daughters. So thank you, Dr. Stokely, for being here tonight. Our second speaker is Dr. Shanna Combs. Dr. Combs received her medical degree from the University of New Mexico School of Medicine in Albuquerque, New Mexico. She then returned to Fort Worth, where she completed her residency training in obstetrics and gynecology at John Peter Smith Hospital. She has practiced in Fort Worth as a full-scope obstetrician and gynecologist since 2012 at John Peter Smith Hospital and at Texas Health Harris Methodist in Fort Worth. Earlier this year, she has made the transition to Cook Children's as a pediatric and adolescent gynecologist, but is still working as an OB hospitalist at Texas Health Harris Methodist in Fort Worth. So she sees the gamut. Welcome, Dr. Combs. We are excited to have both of you with us tonight. And I hope that this is a lively conversation where we can learn a lot from both of you, as well as maybe answer some questions or relieve some myths that may be out there. So I want to get a pulse. So I'd like to do one poll before even getting started tonight with our discussions. I want to get a pulse on how you all that are with us tonight feel. Poll question number 1, please. As a provider, are you providing pregnancy-related oral health information for your patients? It doesn't matter if you're a dentist. Are you as a dentist giving information to your pregnant patients about the importance of oral health? Or as an OBGYN, are you giving that important oral health information to your pregnant patient? So it's yes, verbally and or printed materials, yes, providing printed materials only, or no, I'm not providing oral health information. We won't judge. You will not be counted. This is aggregate information. All right. Okay, good to see this. I'm so proud of y'all joining tonight. 3% of y'all are saying yes, that verbally you are providing some sort of oral health information for your pregnant patients, or verbally and or printed. That's great. Now, I'm not judging the 22% that said they're not. That's what we're here for tonight. That's what we're here to talk about. So, with this poll being said, I hope this is an eye opener for us to see that we still have work to do. I have a few questions that I've developed and I'm going to be asking the panelists tonight. We answered a lot of important oral health and safety of dental care during pregnancy with our first session. So if you missed it, you can still watch the recorded session on our YouTube link and at the Department of State Health Services link, and we will be sharing that with you all for sure at the end. So please, there was a lot of great questions specifically asked, and we want y'all to be able to view that, but we don't want to repeat all of that. But safety is a big concern, but we're not all providing oral health information to our pregnant patients. So I want to find out from our panelists tonight. Dentists are very much needed at the table during the pregnancy journey. We heard that importance in that first session. If the dental health of a pregnant teen or woman is not treated, will this impact their overall health? Dr. Stokely, I'm going to start with you tonight.
All right. Well, yes, it will affect her overall health, and it can do that in a number of ways. For one, just a toothache can be uncomfortable. It gets bad enough, you're not going to sleep well, and you're not going to be eating well either. So those things can impact the woman and impact her pregnancy. Another is the inflammation. If she has untreated gum disease, that inflammation doesn't just stay as bloody gums in the mouth. That inflammation passes along through the bloodstream. And there's studies that show us there's connections between that and preterm labor. Not actual one causes the other, but significant connections between the two. I want to clarify that. And then say there's an abscess, the cavity doesn't get treated, an abscess develops. I mean, that can be life-threatening for someone. So there's a lot of different ways it can affect her overall health.
So true. With Dr. Combs, with what Dr. Stokely said, or what are your thoughts on how it impacts a pregnant woman's overall health when their oral health is not intact?
Absolutely. So, just to kind of echo what Dr. Stokely was saying about having that kind of, poor dental health, inflammation, infection, all of those things, there has definitely been some evidence to show that it contributes to concerns for preterm labor and preterm delivery. So affecting kind of the health of the pregnancy, and then just overall health. If you have poor dental health, teeth that are falling out, for lack of a better word, you're just, it's harder to eat well if you don't have good dentition. And then also a lot of times if you're hurting in your mouth, you don't want to eat. And so that can also lead to, poor nutrition during the pregnancy as well. And so affecting kind of that pregnancy health, but then also kind of that long term. Also, the last thing with the, dental infections that lead to abscesses, those can actually turn into full-on sepsis. And sepsis is high risk no matter what. It's even higher risk in a pregnant patient because they're already in a fluid overloaded state. And so puts the mom at significant risk if she gets infected with and septic from a dental infection.
Wow, that's a really good point. And we hear it all the time that dentists, unfortunately, sometimes are really scared to treat that pregnant patient. So it's important to do this, but what does this mean for the unborn child? Are they also at risk if the mom's oral health is not in check? We talked about some things that could maybe happen with mom with oral health disease, but how does this impact the baby? Dr. Combs.
Well, I think the biggest thing is it's not so much that like the infection is going from their mouth through their body, through the placenta to the baby, is because the placenta is a great barrier, it does block a lot of things to the fetus. But more than anything is if they end up having to deliver early, that baby could be born premature, requiring NICU admission. And putting them at a significant risk if they're born early as far as lung development and brain development and things like that. But on the flip side, if mom's not taking care of her dental health, that's also, we always say the way goes the mom, the way goes the family. And so the mom may not be, if she doesn't understand the importance of dental health and how that affects her overall health, not really kind of educating her children about that as well. And so I always say pregnancy is a prime time to educate women because they're the most motivated when they're pregnant. And then that influences the entire family so that they can have optimal oral and dental health as well.
That's good. But if they don't know about the connection and the importance, then they're maybe not going to have that. So again, hence the why we need to have those conversations. So Dr. Stokely, what's your thoughts on that, on the unborn child?
Well, I mean, I agree with what Dr. Combs says, getting mom on board with good oral health and just the right habits and understanding the importance of all that is going to really impact that child's oral health. Both in just learning habits and the importance of care, but even if that mom has a mouthful of cavities, she can vertically transmit that disease-causing bacteria to her baby through just common mom behaviors. Often you'll taste the food, make sure it's not too hot before you give it to baby, or you'll see people that the pacifier falls. Well, mom will just clean it off in her mouth before handing it to baby, which is kind of gross, but I'm sure they're thinking, well, less gross than the street, right? But still, there's lots of ways that mom, if she's got all this bacteria, passes it along to baby. And that's how babies can get that disease-causing bacteria.
Wow. And so important to have that type of conversation prior to that baby even being born, right? So again, another reason to be educating that pregnant mom early. So tell me then, what worries you most when you are thinking about providing care to a pregnant teen or women? What worries you most, Dr. Stokely, as a dentist? What concerns you?
I guess I could look at this kind of in two different ways. My first thought of answering this question is what worries me the most about is them not getting it, right? Them not getting the message that they should come, because I can't be out there on the street, hey, pregnant women, come in, So if they don't know to come or they're scared to come and no one's telling them you should go, that's my biggest worry. And then my other way of looking at that question is what literally worried me when I was seeing patients. And really it was safety concerns, I mean, this understanding how safe it is did not happen to me overnight. I mean, I graduated from school back in 2005. And I know back then, and I don't the general sense I have of what I learned with treating pregnant women was that you really didn't do it unless it was an emergency. If it was bad and it couldn't wait, you did it, but otherwise you didn't touch them. Maybe get the one most critical x-ray that you needed and don't do anymore. And it's hard to change that mindset. I mean, boy, what we learn in school, it's so hard to shake. And so just general safety would worry me. Like I said, it's been a journey to get to where I feel like it's absolutely the right thing to do and shouldn't be delayed.
Great information. Dr. Combs, what concerns you as an OBGYN for a pregnant mom to get dental care? I mean,
that all the dentists go, no. So yeah, no, I always, it goes back to that point of like your oral health is part of your overall health, so I always say, forget she's pregnant. There's certain precautions that can be taken. So like, for example, if you need to get x-rays, get x-rays. If you can defer till after she's delivered, then defer. But, just keep in mind shielding. I mean, we shield non-pregnant women in the dental chair. So same thing with pregnant women. You know, sometimes women come into the hospital in the ER and they get put in a CT scanner before they knew they were pregnant. And so way more radiation exposure, and 99.99999% of the time, nothing happens. So I think, being precautious, but recognizing that oral health is important, and it's still important in a pregnant woman. I always point out that, as an OBGYN, so many times it's like, oh my God, she's like a day pregnant. I can't treat her. I can't do anything for her. And in reality, you can. And I want you to be comforted in the fact of, you can take care of them and help them with their oral health, because just because they're pregnant doesn't mean that that the rest of their body doesn't need to be taken care of. And so really, being comfortable, recognizing like appropriate shielding, all of those things. But, like one of the questions I often get is, if they need antibiotics for an infection or something, they're like, is this antibiotic safe? And I'm always like, hold on, let me check. Because I'm an OB and there's so many medications out there. I can't keep them all straight, what's safe and what's not safe. I know kind of the common ones that I use that are safe and things like that. But there's tons of resources out there to know kind of what's safe in pregnancy. I think the time when a lot of people are most fearful is in that first trimester, because that's like organ development and things like that. And where you're going to give mom things that might harm her or the baby. But like most of the things that you use, antibiotics, topical anesthetics, those are all things that are fine and safe to use in pregnancy. So I wouldn't worry about that as much. And then more than anything, as they get bigger pregnant, just being in the dental chair and kind of laying back, they might get dizzy, weak, lightheaded. So definitely taking into consideration that you kind of want to tilt mom off to the side. I always tell moms, when you're just out and about, you might want to take a pillow with you anyways, just as far as a comfort level thing, to sit behind their back, or also kind of tilt them when they're in the dental chair. But please don't run from pregnant women. They need you.
Good. That was a good line to end on. I know in our first session, Dr. Palmer, our OBGYN, Dr. Palmer, that was our speaker then, said, well, it's just mean when you don't treat pregnant women. And I thought, well, there you go. I can remember that. So anyways, you ended on a good note with that. It's a good reminder to us that there's still a human being connected to those teeth and they need to be treated. Yeah. So,
and if I can interrupt real quick, our practice guidance that we developed that's on our website, hopefully somebody can type that in the chat box. I didn't, surprise, I'm announcing this right now. But it's got information about like antibiotics and which ones are fine to give. And it even has some images about how to properly position a woman who's very pregnant, like where to put a pillow, just so you can kind of tilt her in a way that she's comfortable. So that way you don't have to guess. You can look at that picture and do what it says.
The website was just put into the chat box. So please, everybody take a look at that or take a picture of it or whichever. It's some really good information. The Texas Department of State Health Services has spent the last several years putting a great packet, a great amount of resources available out there. There's no guesswork. They've got it out there for us. How do you define a high-risk pregnancy? In other words, so many dentists and so many physicians or healthcare providers already think, well, if a woman's pregnant, they're considered high risk. Is that true? Is that myth? What? Tell me, Dr. Combs, you're shaking your head.
Absolute myth. The reason why I chuckle is because I always remember when I was still doing full scope, like women calling the office or talking to my nurse and always being like, well, I'm a high risk pregnancy. And I'm like, well, in reality, like the criterion to be considered high risk per like medical billing is like really, the bar is really low. Like if you started your prenatal care late, if you're a teenager, if you're advanced maternal age, if you're overweight, if you're obese, like there's so many factors that make you quote unquote high risk. So the thing that I would say is some of those high risk patients actually happen to be the ones that need their oral health the most. Those are like the ones who have a history of preterm delivery or preterm labor. And so optimizing their oral health, since we do know there's a connection there, I would say is super important. But, you know, again, going back to the don't run away from the pregnant woman, is everybody, you know, like, it's as soon as they become a nanosecond pregnant, everybody's like, hands off, I'm done. I can't do anything. And in reality, you can, and women still need oral health and regular health care when they're pregnant. That for me as an obstetrician, like, don't ask me to do dental care. Is you know, I've told Dr. Fukue and Dr. Stokely before. I grew up in a dental clinic. My father's a dentist, and so, you know, even then, I'm still like, no, that's just not my area of expertise. And so, I want your help for that. Versus, you know, if you have a question about OB, reach out to me. Let me know. See how we can work together.
That's awesome. Dr. Stokely, what are your thoughts on that with the high risk?
I go with what our medical experts say. I follow what Dr. Combs and Dr. Palmer last time said, which, I mean, it's quite similar, that really, if it's high risk, you know, but it's an interesting point you brought up, and something that she didn't before, and I hadn't thought about this. Women may think of themselves as high risk pregnancy because of like billing kind of stuff. I mean, I guess that means I had forgotten that, but I guess technically I was a high risk pregnancy, very healthy pregnancy, but I was 35. So that made me high risk when there was nothing else going on. So we've got to be aware that when some women come in saying they're high risk, they really may not be high risk. But then I know that puts the dentist in a position where, well, this lady's coming in saying she's high risk. I know Dr. Palmer had said last time that really, if they're that truly high risk where it would really be a danger, they'd probably already be in a hospital. Mm-hmm. Do you agree with that, Dr. Combs? Or
yeah, no, absolutely. Like, and that's the thing that, like, I would always kind of point out is, if there's ever a question or a concern, you know, you can always reach out to the OB. But for the most part, as you know, so many little things can make a woman high risk pregnant. So if they say that to you, you know, it's kind of maybe asking a little more, or even just simply asking, you know, has your OB said you can't see a dentist? You know, because and in my mind, I'm trying to like scroll through, like, is there ever a circumstance where I would say that? Yeah, when they're admitted to the hospital, but beyond that, probably not.
Right. And that's a really good point, Dr. Combs, that when we as providers are asking questions of our patients, we have to remember they don't have that medical health back knowledge. We have to ask the direct question specifically to what we want to know, right? Did they ever say you were, like, you've got to ask that specifically, right? Because, you know, general, and again, what they read, so many people go to quote what I like to, most people say, Dr. Google. Everybody Googles stuff. Everybody looks on the internet, and there's not always accurate, correct information, and lots of myths out there. So good point. Well, so what are some of the challenges that dentists face to provide care to pregnant teens or women? Dr. Stokely, you being the dentist, what are you seeing are some of the challenges or concerns that dentists are really having?
Well, one is, again, getting them in the door, right? They have to know to come. But I've had patients come in that, I mean, wanted the bare minimum done, maybe have their teeth cleaned, no x-rays, and examined. They were very fearful, very worried that it was not safe to do it. And I'm trying to reassure them that it's safe, but at the same time, yeah, I mean, you can imagine patient might be thinking, yeah, but you're the one that's going to get paid if I do this. You know, I mean, and I can understand someone feeling that way, but yeah, getting that woman reassured that it's okay to get the care that she needs and not to put it off, I would say, is one of the big challenges.
So do you think this is part of the reason why we really need OBGYNs at the table with us dentists, speaking about how important it is? So they're bringing it up, because I noticed, and I
Yes.
asked this question the other day, when a woman becomes pregnant, the OBGYN becomes the quote primary care provider almost. They go to them and ask them for about everything. So,
Mhm.
Dr. Combs, what are your thoughts with that?
Yeah. No, I think it's super important as an OBGYN to make sure that you're talking to your patients about oral health. A lot of times I would have like a blanket letter. I called it my dental letter. And so it was like a blanket letter talking about, yes, they're pregnant. Yes, they're under my care, but, make sure you shield if you have to do x-rays. These are safe antibiotics. These are safe anesthetics. And then, so the patient had that, and really just kind of pointing out that it's okay to go see a dentist and that it's safe and it's actually good for you and your baby to get good dental care while you're pregnant. And so I think a lot of times just reinforcing that, they're like, oh,
Yeah.
I was going to cancel that appointment. So
Yeah. Yeah. So
yeah,
you're bringing it up preventatively before they're even bringing it up. So
yeah,
basically, are you saying that's part of your kind of not new patient, but newly diagnosed pregnant
yeah.
woman in part of her new packet that letters in there?
Yeah, because that's a lot of, kind of that new OB visit is kind of like you hit them with a lot of information about, good eating, healthy exercise, and then part of that component is also good oral health, and so making sure that they know it's okay to continue the dental care during the pregnancy.
I would
Okay.
sometimes have a pregnant patient come in who would have something from her OB-GYN, kind of like what you said, the little pre-printed, it's okay to do these things, all this stuff. And it was just great all the way around. It made her feel very confident that the doctor was on board and that it was okay. And especially when I was still kind of building my comfort level with treating pregnant women, it very much reassured me and removed any doubt because I had something right there I could put in the chart saying, yes, this is fine. So I always loved it when someone would come in with that just ready to go. It made a lot of difference.
That's a great pointer, I mean, you made a great segue to my next question. This just goes right along with it. There are so many perceptions out there and barriers actually to maternal oral health. So, what are you seeing in practice or have seen for both of you, or what are you seeing in the community related to referral coordination between the medical dental providers? Dr. Combs, we can start with you.
Yeah, I would say there's a lack of coordination, unfortunately. In working with patients, to be able to get into a dentist that is willing to see pregnant patients, I think is the number one kind of hurdle there. And then, other issues sometimes play into factors like far as coverage and things like that, if they have dental coverage versus not. Um, you know, I I find it so funny that like, oral health is kind of considered like this other thing, even though it's like right here in the middle of our body, by this kind of other important thing, our brain. Um, and so yeah, no, I think it's a lack of providers' willingness to see pregnant patients, but then also a lack of coverage for patients, and then also lastly, just a fear factor for patients as well as is not wanting to go see a dentist because they think something might happen. And so, unfortunately, a lot of times what ends up happening in pregnancy is a woman with a toothache ends up going to the ER. And so she gets put on antibiotics and painkillers, and like the problem's not addressed. And so that's kind of like that's where the donut hole is, so to speak. So once they're seen in the ER, it's like, then what? They feel a little bit better, they take their antibiotics, and they go so long, but they never really got the underlying issue addressed. And then the concern for that is sometimes by the time they come back to me, they already felt better, so they don't even bring it up. And so it just kind of leaves that, donut hole, so to speak, where they're getting just kind of catch up care as can.
Yeah. Well, let me do this, Dr. Stokely, since this goes right with this.
Yeah.
Let me start with you to saying now that you've heard that there is a lack of coordination, there is an issue there. what do you have any suggestions to improve that referral process? I mean, what can we do as dentists to really get engaged with our OBGYNs?
I don't have a good, easy answer for that. I would hope in places like FQHCs where there's, medical and dental together. And I don't know exactly how. I know there's attention being placed on efforts to coordinate care through those means. I'm hoping it's a lot easier for them. It's a tough one for us. I mean, it's just different that it seemed than the relationship I would have with, say, the oral surgeons I would refer to, or the endodontists. With the OB-GYNs, maybe it's just because there's so many, there could be such a broad, and I'm sure the other way too, there's so many dentists. Um, and I don't know if it's just that, and then just maybe that sort of traditional mindset that we're somehow different enough to be kept separate. I would say one, but I hate to just say, oh, I don't know. I mean, one thing that would help, I think, especially for on the medical side, is finding some of the dental clinics in the area, at least having a few names, some places that accept Medicaid, some places that maybe accept some of the more common insurances, so you've kind of got a short list. And I would say to that, meet them, I mean, kind of vet the people, right? And make sure it's somebody you feel good sending your patients to, the same way we would the other way around.
Right.
But work on having that list of people. And beyond that, I'm not sure that I have any better answer to give. It's a tough one.
It is a tough one.
Yeah. It's a hard question. I think one of the things is, as we're kind of, exploring different ways to have healthcare, in the state, but also, and, in the country, is because the fragmentation is not just between, OB and dental. There's lots of fragmentation of, we're all in our little silos doing our own thing. And so I believe in Houston, one of the concepts they did is what's called an OB medical home, where they had OB care, they had pediatric care for once the baby was born. They also had dental, they had ophtho. I was like, what a concept, one-stop shopping, especially for like a mom. And so, I think as we kind of move forward and, more out of the box thinking, but even something simple as, like I have the people I think of when I need if somebody needs a general surgeon, I'm like, oh, you're going to go to this person. And so I think it is super important to, get to know just a couple people in your community. And then definitely, again, that, connection building, oh, I know Dr. So-and-so, they're a great dentist. I send my kids there, I send this there. I think that really, really helps. And so I think I know it's hard, but we got to get out of our silo and get to know people and make connections so that we can make better connections for our patients.
And I would say to just to add to that, if Dr. Combs did refer someone to me, she'd kind of found me, I seemed like a nice, good dentist, and referred a patient to me, develop that relationship, send something back. Thanks for referring patient such and so to me. We took care of her needs, please let us know. Just something that kind of builds some connection, reciprocate. And so you get to know that referring provider.
Mm-hmm. That's so great. And at the end of the day, like Dr. Combs said, it's about our patients. And if we don't advocate for them, who is? They're our patient. And that mouth is connected to the rest of that body in our office, right? So this is a great time for a poll question that falls right in the category of what we've been discussing. So our second poll question, if we can please bring that up. As a provider, do you provide written dental or medical referrals for your pregnant patients? I'm curious, as we've been discussing this, if anyone on the call with us tonight, are you all providing written dental or medical with it, whichever way you're going? So it's yes, no, or maybe you're not really sure. Maybe you're one of those providers that lets your staff do a lot of that stuff, right? Our nurses do that, our dental assistants, our hygienists in the dental office. So it can happen. 50%. I'm excited about that. That's better than some of the other polls that I have seen. So 50% of you are providing some sort of referral back and forth, and that's awesome. So with that being said, what changes would you like to see long term as providers and leaders in this arena? You're here today speaking on it. You're very passionate. Both of you are very dedicated to this concept. So what or how or what are your ideas of how we can work together to advance oral health in during pregnancy? Dr. Stokely, we'll start with you.
Okay. So my big dream on this is with future generations of dentists and OB-GYNs, that they learn in their schooling the importance of prenatal oral health. For dentists, that the safety of it and so forth. For OB-GYNs, the importance, hopefully get some of it in medical school. And then as they specialize, continue to learn that it's just an important part of that checklist for your prenatal or, prenatal health for your patients. So then we have future generations that is just ingrained in them. It's what they learned, and then with ones of us who are out already that we get to the point where us dentists have heard it enough that it's safe, that we feel comfortable doing it. It becomes a routine habit for prenatal providers to just have this in the prenatal checklist of things to do, the packet of information. It's just secondhand. It's there. You almost don't even think about it anymore. You do, but it's just so automatically because it's ingrained into your systems. Mm-hmm. That's what I want. That's what we're doing our best to try to work towards that.
So Dr. Combs.
Yes, for education. I'm an educator at heart. So I definitely think it needs to be part of kind of, medical and dental education, that the importance of oral health, how it impacts the entire body. And so, I think getting it at that phase, and then definitely, like if you think about it, like I always joke, the dirty little secret of pregnancy is it's 10 months, not 9, because it's 40 weeks and it's not really months. We don't use months, but anyways, but so like if you think of 10 months, like you should be seeing your dentist at least once. And if it falls right, it should be at least twice. And that's if you're not having any problems. And so I would say, I think it's super important for OBGYNs, and as they're training to learn this, and then once they get in practice, like that's just part of your checklist. At 20 weeks, whatever, have you seen your dentist this pregnancy, and are you planning on seeing your dentist? Do you need a dental note? Just kind of make it part of the care and discussing the importance of it. And I think as we learn more and more, there's so many things in obstetrics. I call it the big gray hole, because there's so much gray in our field. And so, one of our big wish we knew the answer to is like preterm labor and preterm delivery. And we keep getting little snippets. And so I think one of those big snippets is oral health. And so, ideally, if we can improve oral health, hopefully we can help have an impact on preterm labor and preterm delivery. So I think definitely, kind of public health campaign as well, really focusing in on the importance of your oral health and how that can affect you and your baby.
Yeah, that's great. That's the pie in the sky, right? I love it. I love it. One last thing I'm gonna bring up. There's the safety concerns. There's just the knowledge and working in the silos and all that good stuff that we've just discussed. But we've all said it tonight, and we all know it, I think, on this call, that it is important to ensure prompt and early access to oral health care for pregnancy. And we all must do our part to help that pregnant mom. But what can we do to prioritize the coordination of the care? So, do we go ahead and do that initial letter like you said?
Yeah.
What would be any other parting thoughts on how can we really coordinate and we help us to cross collaborate, right? Cross collaborate fields.
Yeah.
So we're not siloed.
I was going to say things like this, where you're bringing in OBs as well as dentists, kind of, bringing us to the same table. I think is super important to understand how it has an impact. And then I think, definitely from like the OB side of things is really just trying to make that part of your routine prenatal care. One of the things that comes up a lot, especially first, early on in pregnancy, is like bleeding gums. So a lot of times just brushing your teeth, causes a lot more bleeding of the gums. And so, maybe your patient brings that up to you and you're like, oh, by the way, let me tell you the importance, like some women, if your gums are bleeding when you're brushing your teeth, you may think, oh, well, then maybe I shouldn't be brushing my teeth. And that's the exact wrong thing to be doing. And so just keeping in mind some of those common things that happen with pregnancy and using that as kind of a jumping off point of really talking about the importance of oral health. And, please keep brushing your teeth, as well as helping them to know that it's okay to go see a dentist and kind of get your normal care, so to speak.
Right. Dr. Stokely.
I'm a big believer in processes. Again, just make it where you don't really have to think about it each time. Put it in the health history, put it as the checklist at 20 weeks, like Dr. Combs said, just integrate it into the system, and you're not having to remember it every time. It's already set up for you. And we want to try to get dentists where they feel like they don't have to have that clearance letter. But if you're a practice that you stand firmly, you want that clearance letter, set up your processes to where you're asking if a woman's calling, new patient, are you pregnant? Or even an existing patient, set up whatever process you want. So if you want that clearance before they come in, you don't have that wasted chair time. They come in, you don't feel comfortable seeing them. You send them home. They may not come back, and you lost chair time. So fix things on your end to get ahead of that if it's important to you to have that clearance. So just things like that, I think, can help a lot with coordination.
That's a really great point.
Yeah, I was going to say, it's like nowadays, every time you go to a doctor or a dental visit, it's like, do you have a fever? Do you have runny nose? Have you lost your smell? We ask all these questions all the time. And so I think it's definitely, just wrap it into kind of your process. If a woman's coming in, when you ask all those questions, one last question, are you pregnant? And then you can add the simple question of, does your OB think you shouldn't be, is your OB okay with you seeing a dentist? Definitely make that process easy for the woman. And like you said, so you don't waste their time, but you don't waste your time too.
Yeah, exactly. Good points. I think as providers, we all say when we attend a CE course or we join something like this, we all want to get a nugget, right? And those are some really good nuggets that y'all just mentioned, that making it routine, making it part of our everyday thing. Once we make it that way, it'll be that way for our patients, right? As well. So I'm gonna stop us here. I want to be cognizant of our time, and I want to open it up to the folks that are on the call tonight. Please put in your question in chat. Let us know if you want us to unmute you so you can ask the question. You've got two great panelists here, willing and ready to answer questions. Let's take advantage of this. I know. We won't put them on the spot.
I know, don't you? I'm always like, oh gosh, that part always makes me nervous. I feel like I'm talking about until someone starts to ask a question, and I'm like,
all right, folks, let's see. I'm not seeing anything in the chat box. Let's ask these ladies some questions. I know y'all are itching. Well, while they're thinking maybe of some of their questions, Dr. Stokely, do you have anything that we haven't talked about yet tonight, and you just want to be your last part, and you want to make sure people know something that you feel is really important?
Maybe one thing is that with our program, we really want to prevent early childhood caries, early childhood tooth decay. And this is the way, one of our approaches to doing that. I mean, we want that pregnant woman to be healthy, of course, and have good oral health. But getting her on the road to good oral health is going to reduce the chance that that baby, that little child 5 and under, is going to have tooth decay. Because, you don't want them to have tooth decay, right? I mean, you don't want sleepless nights and pain. But when they're little ones like that, it's not just a matter of going to the dental office. They may have to be sedated. If it's bad enough, they may have to go to the hospital for care. And it's a really big deal for little ones to experience tooth decay. And so this is one of those upstream ways that we can try to prevent that. So for that reason, too, it's very important.
Well, Dr. Stokely, that is a really great point. And it just so happens, I'm grateful you brought that up, because we do have a question from a pediatric dentist saying, "Hi there, I'm a pediatric dentist and I was wondering about the effect on the added weight on the airway, throat, and potentially affecting sleep. I'm a big screener for sleep disorders, breathing, and I'd love to hear your thoughts."
Pregnancy. So yeah, no, I've actually, I had worked with a sleep specialist on a project for her, looking at sleep disorder breathing. So, they may have issues beginning, before they're even pregnant, but pregnancy just definitely exacerbates those issues. I always say you've got this big bowling ball, literally pushing all of your abdominal and your pulmonary contents upward. And so, yeah, there definitely is some issues with sleep disordered breathing, or sleep apnea associated with pregnancy. So definitely something to watch out for.
Great. Good point. Good point. Anything you wanted to add to that, Dr. Stokely?
I'm glad you're screening your kiddos for sleep disordered breathing. Talk about having a life-changing impact on a child if you can intervene with that.
Exactly.
So, thank you.
Kudos to you for doing that. So, another question here. Do either of you panelists have tips for starting the list of providers to refer to? In order, do we just Google dental or OBGYN providers near us and call them, or is there a better way?
You want to go?
Yeah, I always joke. So as a female healthcare provider, I have always said, ask your friends, ask your, like moms talk, they talk about good and they talk about bad. And so I definitely, and that can get, that can go with like, your patients. Like if a patient says, hey, I'm going to see my dentist, and I'm like, oh, who are you seeing? Because knowing that they're pregnant and going to see a dentist, that definitely is a good referral. I'm terrible at Google and filtering through all of the, bad stuff. There's lots of bad information on the internet. So I definitely think that's where like connection and community and, talking to your staff, like a lot of times asking, like for me, asking my MA, my nurse, my front desk person, because they interact a lot more with some of the outside world, so to speak. And so may have a better idea as well.
Mm-hmm. Great.
Yeah, I think that's good advice. Ask your friends and colleagues who they use. And then I would also say too, in terms of like Googling to look for something, you could look for clinics in your area. If you have patients that are of lower income, you might or might not have a friend that goes there, but it's good for you to know what's close by that you can send patients to, because presumably if your patient is coming to see you, they're somewhere in that general area. So I would think, a similar location would be good for them as well.
Yeah, great. Great point. Another question. Is there any specific dental advice that dentists should give to their pregnant patients?
Keep brushing your teeth. I think it's one of those things, like, it's scary if you have bleeding gums, like that just kind of freaks you out a little bit. And so I think just in encouragement to, you continue to do your oral hygiene. The other thing is, a lot of times when women are in the first trimester and having a lot of morning sickness and things like that, that really acrid kind of smell and taste of toothpaste can really make them want to throw up. And so, and even just the idea of having a toothbrush in your mouth. So you might want to use a smaller toothbrush, and then, trying to find a toothpaste flavor you like that doesn't make you nauseous. Peppermint and spearmint, all those are very, those are scents that are used for nausea in general, as well, with like essential oils and stuff. And so I think, trying to help them to continue the oral health routine, I think is most important.
Yes.
Yeah, I mean, if you're prone to gag from a toothbrush, get a child-sized toothbrush. It's tiny, but boy, if you're able to at least get in there and brush, then that's the best toothbrush for you. So yeah, things like that. And I would say too, the bleeding of the gums. I feel like a lot of people would be more likely to go see about something that hurts or is painful. But again, like Dr. Combs said, they may just stop brushing their teeth if it bleeds, which makes sense on some level. But yeah, just keep brushing and floss your teeth and don't let your gums get all inflamed.
Great point. And again, that's a great reminder for dentists. Just because they're in our dental chair doesn't mean they know exactly what they're doing. We all went to dental school. We know the information. We need to be sharing that with our patients. They don't know that. And I find that even professionals who are well-educated folks don't even know that kind of information, right? We can't assume. What are your thoughts on pregnant patients using chlorhexidine rinse to reduce the bacteria and the risk of vertical transmission and stuff?
Do you have any feelings about chlorhexidine, Dr. Combs?
No strong feelings.
I mean, it's going to be a prescription mouth rinse. The dentist will have to prescribe it. But I think that's fine. There might be a cause for it, particularly if there's, a lot of inflammation. But I don't think it's absolutely necessary. I think just basic home care, brushing, flossing, I think can get the job done too. So I don't think you have to go to that extreme.
Great. Well, thank you, ladies, both, for all your information. Thank you so much, Dr. Stokely and Dr. Combs, for taking your time and being with us here this evening, for being passionate and thinking outside the box in this way to really connect the oral health, to the rest of the body, especially to a pregnant woman. And if we're having those conversations early, like Dr. Stokely said, we're hopefully creating and starting a good example and pathway to good oral health that will start that baby right on the right path. So let's go way upstream and let's think before that child's even born and start with the mom. So I think this is a great point.
Thanks for listening. And I ask you to share it with a friend or a colleague. So just help spread the word about how important this is, how important prenatal oral health is.
Good advice. I like that. Dr. Combs.
Don't be afraid of the pregnant woman.
I love it. So true.
Just like everybody else. So please don't be afraid of them. And ask your friendly neighborhood obgyn if you have a concern.
Great point. Elaine, can you please bring up our last slide so we can give everybody the information and the links? But we are really hoping to for the beginning of the year, so be on the lookout. Elaine Vivens is our coordinator. Thank you, Elaine, for helping us support and coordinate all this with the Texas Department of State Health Services. We are very honored and privileged that the Department of State Health Services asked to really collaborate with us and see what we can do here in Tarrant County so we can mimic this concept and this idea and open the doors to conversations in the state of Texas. So thank you, Dr. Stokely, for thinking that our area has got some gusto here starting to have these conversations.
There is some gusto.
Thank you. Well, Elaine Bivens' contact information is on here with the coalition and her email. Please reach out to us with anything else. But thank you all for your time this evening. We appreciate it, and we hope to continue these conversations.